Hello friends, today's topic is headache. This is a very important and relevant topic. This video is specially for my non-Bengali follower and subscriber. In this video, I have including the definition of headache, the types of headache, causes, the causation of headache, a risk factor, and diagnosis, treatment, and management. At first, definition of headache. What is headache? Pain in the anywhere of the head, that is called headache. Headache basically divided into two types. Headache are basically divided into two types: primary headache and secondary headache. Primary headache. What is primary headache? Primary headache is there is no underlying pathology or no causation, but cause is unknown. That is due to the stimulation of the nerve by the chemical mediators in the brain. Primary headache are divided into four types. Number one is migraine headache. Number two is tension type headache. Number three is cluster headache, and number four is trigeminal autonomic cephalgia. First one is migraine headache. This is the most important type of primary headache. Migraine headache or unilateral or one-sided headache. It may be unilateral or bilateral. And special type, this is a pulsating or throbbing type of pain, and this is moderate to severe. And after that, it is aggravated by or causes the avoidance of routine activity of the daily life. Due to daily life activity or nausea or vomiting and unusual sensitivity to light or sight, aura, visual, sensory, speech disturbance, etc. This is the conclusion of this headache. This is mostly familial. This is a multifactorial causation behind this, and mostly familial or genetic. And due to daily activities or light and sight aggravate the headache. This is the funda, and it stay 4 to 72 hours, and women may find during the menstrual cycle. After that, the tension type headache. What is tension type headache? Muscle tightness in the temple. Patient complain the muscle tightness on the temple region, and sensation of the tight band pressure around the head, and continuous pain, bilateral pressing, tightening, and mild to severe. This is a continuous pain, and bilateral and pressing and tightening type of pain, and it is due to the mental stress. Due to the tension type, it is due to the mental stress or anxiety. After that, it is not aggravated by routine or activity of daily life. It stays 30 minutes to 7 days. Causation: stress, fatigue, arthritis, eye pain, and the poor posture. After that, the cluster type of headache. What is cluster type of headache? There is the unilateral around the eye along with face. Basically, it occurs the unilateral or one-sided and around the face, with including the eye. Is a variable and severe to very severe. Cluster type of headache, it is very severe to very severe in form, and restlessness or agitation. In migraine type of headache or tension type of headache, there is no restlessness, but cluster type of headache, it is a patient is very much restless, and cranial autonomic symptom at the same side of the head, like as the red eye, watery eye, swollen eye, and nasal congestion and nose block and runny nose and sweating and so on. It stay 15 to 180 minutes. It is the all types of primary headache. After that, we go what are the risk factor of headache or primary headache. What are the risk factors? Number 1 is anxiety or mental stress. Number 2, tension. Number 3, insomnia or loss of sleep. Number 4, irregular diet. Number 5, the skipping meal. Number 6, eating some substances like chocolate, coffee, alcohol, and this type of food aggravate the headache. Management like the yoga, meditation, and the regular exercise. And what are the diagnosis? Diagnosis is CT scan. In the primary headache, in case of primary headache, what are the types? There is no underlying pathology. CT scan differ what is that is primary headache or secondary headache. And after that we go the secondary headache. What is the secondary headache? Secondary headache due to the other pathology on the brain. Due to other pathology, headache occur, that is called secondary headache. There are so many causes of secondary headache. Something just causes of secondary headache. There are a few nasal causes: acute sinusitis, arterial tears, blood clots in the brain or non-stroke type, and brain aneurysm, brain malformation, and there are various type of poisoning, dehydration, some dental problem, in case of ear infection, especially for middle ear infection, ASOM and CSOM, encephalitis, glaucoma, influenza or influenza-like illness, intracranial hematoma, and meningitis. Meningitis is the inflammation of the meninges or covering of brain, and monosodium glutamate and overuse of pain medication. This is another type of very common secondary headache is medication but medicinal headache. Due to excessive use of medicine or painkiller, patient develop after taking a large amount of the painkiller, the patient develop a headache. That is called medicine overuse headache, and panic attack. And there are so many causes of, and trigeminal neuralgia also. There are so many causes of secondary headache. And what are the management of headache? Please remove the mental stress or anxiety, and during sleeping switch off your mobile phone or off your social media platform like Facebook, WhatsApp, Twitter, Instagram, and so on. Please taking a food in regular time and proper time. Don't skip the meal, and avoid the eating substance like chocolate, coffee, alcohol, etc. And what are the red flag symptoms of headache? This is a very important part. What are the red flag symptoms? When a patient come to a doctor or immediately contact with a doctor, what are the symptoms? Patient complain the worst headache in his life. This is the worst headache in his life. Number 1. Number 2, excessive vomiting. Number 3, weakness of one side of the body. Number 4, sensory symptom like the tingling sensation of one side of the body, loss of consciousness, and seizure or epileptic spasm, and the frequency change. A patient previously suffering headache, but suddenly they change the frequency or intensity of the headache. There is a very red mark symptom, or any vision problem or visual disturbance, and all are the red flag symptom of secondary headache, or maybe a cause of maybe a cause of secondary causes of headache and due to the bleeding or due to bleeding from the brain or trauma or tumor or infection, and at that time immediately patient do the CT scan and diagnose the case and immediate contact with the doctor. And treatment, in allopathic mode of treatment, there are some sedative and specific medicine are there. In homeopathic constitutional treatment, in case of primary headache, very good result. Okay, this is the today's topic. Thank you.